LASIK stands for laser in situ keratomileusis. During this procedure, a laser is used to reshape the cornea under a flap to improve your vision and decrease or eliminate your dependency on glasses or contact lenses. A good candidate for LASIK surgery is one whose prescription has not changed from year to year. Patients who are less than 18 are often not good candidates for LASIK because their eyes are still growing and their prescriptions are always changing. Older patients may start to develop cataracts or other eye diseases which can preclude them from having LASIK surgery. In addition, patients involved with contact sports, such as boxing, martial arts, and wrestling, are not good candidates for LASIK surgery because trauma can potentially dislodge the flap. They are, however, a good candidate for surface ablation, which is essentially LASIK without the flap. You are also not a candidate if you have autoimmune disease such as lupus or rheumatoid arthritis because this can affect the healing. Finally, if you have keratoconus, you are not a candidate for LASIK surgery. Keratoconus is a disease of the cornea that can affect the strength and curvature of the cornea, making your prescription unstable. A patient will be taken to the surgical suite and will lie down on a special bed. Anesthetic drops will then be applied to the eye and the eye will be thoroughly cleaned. A wire-lid speculum will be placed on the eye to keep the eyes open. A suction ring will then be placed on your eye and you will feel a lot of pressure. Once you are in position, a laser or blade will create the flap. The suction ring will then be removed and you will see light again. During the next portion, the flap is carefully lifted and you will see a blinking orange light. You will continue to look at this light to keep the eye fixated. The laser will then begin to reshape your cornea. During this procedure, you may hear ticking noises and you may smell a burning smell, which is from evaporation of the corneal surface. The length of this procedure varies, but usually lasts less than 60 seconds. At the end of the procedure, I will put the flap back into place and we will give you antibiotic and anti-inflammatory drops. A clear eye shield will be taped over the eye and we will then proceed in the opposite eye in the exact fashion. During the procedure, we ask that you stay still as much as possible. We will give you a sedative to help you to relax. The recovery period for LASIK surgery is fairly rapid. You may feel discomfort that night, foreign body sensation, feeling like there's something sand in the eye. Usually this is gone by the next day. We ask that you go home, go to bed, get as much rest as you can, and the vision should improve steadily by the next day and within this next week or so.